Go.
Cancer is a horrible disease that attacks the body. It does not discriminate and can happen to you or someone you love. According to Tomer M. Faragi from the Macmillan Group, a research group specializing in organic chemistry, common cancer treatments target an anatomical location or the tumor themselves. Cancer cells still remain hard to treat, especially when in the advanced stages. Because the common treatments can wreak havoc on the immune system and the body, researchers are always trying to find alternative ways to treat or eradicate cancer. In my speech, I will tell you what immunotherapy is, what are some clinical trials that have been done, and who first started to develop immunotherapy. I will start with what is immunotherapy. According to Tomer M. Faragi, immunotherapy employs the immune system's natural potential to recognize and kill the tumors, instead of directly attacking them. Some possible advantages to immunotherapy treatments are that it targets the cancer cells as opposed to attacking the cells in the body, all the cells in the body, which could decrease toxicity to the patient. There are 3 strategies in immunotherapy. The first is therapeutic cancer vaccines, which are vaccines that are antigen-stimulated dendritic cells, which use antigen-stimulated dendritic cells. These vaccines would aim to prompt T cells, which are cells in the human body, activation pathways by using APCs, which are antigen-presenting cells. However, early attempts that used peptides based on tumor antigens were unsuccessful. The second strategy is immune checkpoint blockade therapy. In this strategy, CTLA-4, which is an inhibitory receptor, and PD-1, which is a receptor that is expressed only on T cells. CTLA-4 reduces the first stages of naive T cell activation. PD-1 limits the T cell functions in the outlying tissues and is sometimes overexpressed by cancer cells. The last strategy is adoptive cell transfer therapy, which is when T cells are extracted from tumors and are enhanced for an antigen-specific variant, then reinfused. Adoptive T cell transfer in these trials done on humans only had success in treating melanoma originally. This was most likely due to its high mutation rate. Efforts have been made to modify T cells to expand to cancers other than melanoma. Now I will tell you about the clinical trials that have been done. One study that was written in the Journal of Gastrointestinal Oncology was on using a combination of immunotherapy in conjunction with radiation therapy for pancreatic cancer. Pancreatic cancer has a high mortality rate, and there has been a lot of interest in using immunotherapy to treat it and improve survival rates. This study has 21 trials and used vaccine therapy, immune checkpoint inhibition, along with other non-traditional therapies to prime the immune system. The outcome since the earliest trial has improved, although survival in all stages of the cancer still remains poor even if treatment is aggressive. The second trial that was written in Science magazine is Cancer Immunotherapy Blockade. In this study, CTLA-4 and PD-1 were used as non-redundant immune checkpoints together and separately. The combination of the two together gave the patients a slightly higher survival rate. The last study that was written in Blood magazine is autoimmunity associated with immunotherapy. Vaccines and cytokines are being tested in clinical trials. This study found that immunotherapy can be linked to some autoimmunity against normal self-tissues. Now I will talk about who started and who is still doing the research. First, I will start with William Coley. According to Tomer M. Faragi, William Coley used live bacteria to stimulate a response in the immune system in 1893. In 1909, Paul Ehrlich proposed that the immune system could possibly surveil cancer. In 1987 and 2001, researchers found evidence for T-cell mediated tumor immune surveillance. Penn Medicine started researching immunotherapy in 2003 by mapping the human genome. Throughout the next decade, they continued to build on that research and created the first immunotherapy that was approved by the FDA to treat leukemia. It is called CAR T therapy. In this technique, they retrain the body's T cells to hunt down cancer from the inside and treat it. Immunotherapy could be a good treatment for cancer. In conclusion, a lot of research has been done in immunotherapy and cancer treatment, and more still needs to be done to improve it. Hopefully hopefully one day we will have a cure for cancer and be able to eradicate it like so many other diseases by using our own immune systems. Imagine a world without cancer.